is the Chief Executive Officer of Regina Villa Associates and currently serves on the Board of Directors for the American Foundation for Suicide Prevention, also Chair for their Public Policy Council. Ms. Farrell is the President of the Cronin Foundation to fight ovarian cancer and a member of the Board of Directors of the Brookline Community Health Foundation. On a personal note, Nancy lost her brother Michael to depression 20 years ago. Nancy.
Thank you very much. Sorry. Thanks for inviting me to represent suicide survivors today. First, my congratulations to Dennis and all of his family, and to all of you for supporting this walk and the important awareness that it brings. Dennis worked for Nathaniel and for OCD and BDD awareness and for suicide prevention. We don't want sons and daughters, parents and friends, husbands and wives to die by suicide. And Dennis acted on his own experience, bringing hope to many families. Like all of those who have lost someone, Dennis and his family want to help prevent the nearly 37,000 deaths by suicide that may occur in the United States in 2012, a number that unfortunately has reached its highest level in 15 years. Survivors of suicide know that their journey through grief doesn't come with a map. It's a difficult journey. It's begun in shock and moves back and forth through many stages. There's great sadness, even greater guilt, sometimes anger, and always loss. We take one step forward and 2 steps back. Many survivors seek professional help, join a support group, and find ways to recall happier times through foundations and events. Like Nathaniel, my brother looked into a mirror and didn't like what he saw. Severe depression made him think he would never recover, be happy, or live to have white hair like his big sister. Mike had very good care, but no belief or hope in his future. 20 years after his death, we're just beginning to understand what happens in the brains of those suffering from these diseases. In seeking answers, my family found the American Foundation for Suicide Prevention, known as AFSP. We found a family of people across the country who understood our experience and wanted to raise awareness, prevent suicide, and are using stories like Nathaniel's and their own and advocacy to bring these issues to light. AFSP is dedicated to understanding and preventing suicide through research, education, and advocacy, reaching out to people with mental disorders and those impacted by suicide. We fund scientific research, offer educational programs for professionals, educate the public about mood disorders and suicide prevention, provide programs and resources for survivors of suicide loss and people at risk, and we promote policies and legislation on the state and federal level to help prevent suicide. We don't do this alone. We do it in partnerships with other suicide prevention and mental health organizations, governments, media, and public health officials. We work with veterans organizations, LGBT groups, medical professionals and educators, with college students and coalitions to end stigma and encourage the development of effective assessments and treatments. Like Dennis, we know that you can't make a difference. You can't solve a problem if you don't talk about it. We need to talk about suicide attempts, and how to prevent them. We need to fund more research at a much higher level if we're going to help the 1 million people who attempt to die by suicide each year, and the many thousands who succeed. So AFSP is recruiting survivors, friends, family members, and people like you to serve as field advocates to bring this message to every state house and every office in Congress every year until we get what we need. In only 3 years, we've recruited 500 advocates, and every year we are going to make these visits to these state houses and offices and share stories like the Aslan families, and perhaps yours, to raise awareness and hope, and to urge our leaders to raise funds for research and develop new strategies to deal with the mental disorders that underlie 90% of the deaths by suicide. Our goal is to have 2 advocates in every congressional district, and to see one day a world without suicide. So this isn't an easy path to walk, but like Dennis and his family, many of us have no other choice. We take this walk in memory and in love, and we ask you to join us. Walk with us, talk with us, and save lives with us. And thanks for being here today.